I love taking care of children. It took me a while, but I figured out that this is what I want to do in life. I had another career before in business, and it was very exciting, but I found that the goal wasn't what I wanted to spend my life doing. So I went back to medical school. I love figuring out how the human body works. And I'm like, you know what? I want to be a surgeon because I want to help fix problems. Hello, my name is Erik. I'm the head of pediatric orthopedic surgery and sports medicine at Lurie Children's. So I spent a number of years becoming what I think is a pretty good expert at taking care of children and their hand problems, their upper extremity problems. So some children are born with congenital differences of their hands, things like too many fingers, too few fingers, crooked arms. So I look at these children and I try to figure out a way to maximize their function, some way to improve their everyday life, how they can play, how they can go to school. There are other children who've had really bad injuries to their arms. Often it's a broken bone. Sometimes broken bones heal fine. Other times there are problems like infection or curvature or crookedness. So I help the families figure out if there's a better way to deal with those problems. My approach to taking care of children is to individualize the care. I take input from the child themselves. I don't care if they're 2 years old or 12 years old, they have an opinion. Often I'll go away and study the problem and make sure I know everything possible about that condition. And then I'll meet with the family and together we'll come up with a treatment plan. I can provide some answers, but I provide a menu of options for the parents or the caregivers to decide what's best for their child. We have experts in all the important areas of orthopedic surgery, which include sports medicine and sports injuries, children with spine problems like scoliosis, children with upper extremity and hand problems, children with neuromuscular conditions that include cerebral palsy and spina bifida, as well as children who have bread and butter broken bones. But we also handle the more complicated problems like tumors or cancers, and we have a whole team that will address just that problem. So we have the full gamut of professionals, both nurses, doctors, and technicians that cover from the very simple to the highly complex. Lurie Children's is an amazing institution. Not only do we take care of the children every day, but we have an eye on research and innovation to come up with better ways of taking care of the children. One of my partners and I are working on three-dimensional modeling of problems in orthopedics. We can do 3D simulation on the computer and 3D printing ahead of time. And this allows us to basically practice the surgery in advance and then do the actual surgery, resulting in a better outcome and a safer outcome for our patients. It's a very awesome responsibility that we have. So whenever a family thanks me for taking care of their child, I respond and say, thank you for allowing me to take care of your child, because it's a very sacred responsibility that we have. And I know it sounds a bit cliche, but it's true. So the older I get, the more I appreciate the privileged position I have to take care of these wonderful families and their children.